Now we're going to open this up for questions from the audience. We hope that you've written things down. Let's start over here.
Hi, Steve Reeder from Portland State. Thanks to both sets of authors for your papers. They're very interesting. I have two sort of related questions, and they probably apply differently to the two papers, but one is just a precautionary note or question. I couldn't tell in the paper that Esther did. When you're looking at, the poster proficiency, of course, unlike numeracy and proficiency, as I detailed yesterday, you've truncated out a large part of the population, particularly a low-skilled population, who weren't given the computer-based assessment for various reasons. And so I think it's very important to keep that in mind. And you may well have looked at a similar subpopulation and looking at literacy and numeracy in those models. But so that's the question. Were you comparing different measures on the same populations or on different populations? But a more general point was, and this was different in my findings yesterday about health status. If you remember, I also found no effect of poster proficiency on health status with lots of controls involved. But the measure of practice in the home, ICT practices in the home, was a strong predictor in the same model with or without poster proficiency. So it's important, as Linda was saying, we don't overgeneralize our interpretation of specific findings, because I believe ICT literacy, if it's defined as what people are doing on an everyday basis with technology, is very predictive of health status. And so that's an important point, I think. And that would apply also looking at practices with literacy and with numeracy also.
Hi, David Miller from AIR. Linda, I'll just pick up on your comment regarding that it was surprising to you that literacy didn't seem to be a strong predictor of health. But I think you have to really think about the analysis that they did. It was kind of atypical. Usually people use literacy as a dependent variable, educational attainment as a predictor, but you actually use both literacy and educational attainment as predictors in the regression. So in that sense, the results really are not that surprising, and you have to keep it in that context, that literacy and educational attainment are very highly correlated. I mean, the single biggest way of increasing people's literacy is through more education. So statistically, when you put both of those variables into a regression, then it's not surprising really that one of them is going to wash out. But I mean, going back to your original slide where you showed it, clearly people who had higher literacy scores did tend to report higher health. You didn't actually show the slide, but if you also looked at the educational attainment, you would have seen essentially the same relationship. So as I said, both of those variables are highly correlated. So don't worry, I don't think you do have to change your message. I still think the message really is there that literacy is such an important component.
Yeah, this is Don Liu from the University of Connecticut. I'd just like to reiterate Stephen's comment that poster should not be confused for one's ability to read and use information on the internet. The actual tasks, if you look at them, they're very heavily spreadsheet format dependent. The tasks require a lot of spreadsheet knowledge and not very much knowledge about critically evaluating the source of information or online reading. And certainly it doesn't include locating information, as I mentioned yesterday. So it shouldn't be confused as a proxy for reading on the internet and using online information.
Yeah, and I don't think we, in our paper or intended to use it as a proxy for that. So just to go back to Steve Reeder's comment, yeah, the point is very well taken. I absolutely agree that the ways that people use ICT skills, literacy, numeracy, et cetera, in their everyday lives go, well beyond and should not be conflated with their scores on these kinds of standardized assessments. So, that's something I'm often telling, students in my graduate classes, and, talking to Carol yesterday that, if we had been administered the PIAAC before starting this, I'm assuming our, scores would have run the gamut, and we would have come up with all sorts of reasons why those scores don't actually, reflect what we are able to do in our everyday lives. So yeah, there are certainly all sorts of ways that people may be, using the internet or their literacy and numeracy skills to deal with health that, may not be captured by their actual scores on the scales.
Mm-hmm. And that's consistent with our descriptive findings on utilization of the internet as a source of health information, in that the group of individuals who are low on problem solving, or to be low on problem solving skills, did not constrain utilizing the internet as a source of health information. I think they were at 79%, which is almost, what we were taking as saturation. And I'll back up a few comments to Steve's comment about the sort of biasing in the sample and the net result of not including individuals who failed that computer proficiency test. The way we did our sampling, it has a kind of additional effect. I mean, we have individuals who are low on literacy, numeracy, problem solving, and who failed that basic proficiency test. So what the effect of that on our sample is to essentially make it an even more high risk, even more low skill group. But yeah, the definite constraint on interpretation there.
I have a question for Jan on the phone. Can you hear me okay? It's Margaret Patterson. In one of your slides, you talked about the high use of the internet to gain health information. It was that yellow bar. And when we looked at the group of adults that had the low poster skills, it seemed like they had a very high use of the internet. That seems a little counterintuitive to me. Can you help us understand that?
Yeah, it does, and that's sort of what I was saying to follow up on the previous comment, which is I don't know much about the poster measure, but from that previous comment, it seems to indicate that it's not really tapping the same skills that you would need to utilize health information on the internet. They seem to be use of health information on the internet seems to be much more constrained by literacy and numeracy, and that relates to the content of the internet. Should poster actually tap utilization and integration of information, interpretation of information, then I would imagine then it should be related to lower use of the internet as a source of health information. So I think there's a mismatch of constructs there, and that's why it doesn't really show up.
Ron Pugsley, I would like some further explanation from you about the low level, that literacy does not a strong predictor of health. I go back, I want to pick up on what Linda said. I go back to a conference that the Department of Education held on health and literacy. It was about 1998. And it focused on two basic aspects. One was low-level literacy, and we went into what does that mean? What does that mean in terms of abilities of individuals' ability to read as he or she shops and makes decisions? So the reading aspect was very critical here. It had to do with the message that was being sent to them. But then there was another aspect of this conference that I haven't heard about here that I hope we have more further research into. It was the cost of low-level literacy in health. The only cost-benefit analysis that I've ever really seen in adult education has come from the health field. And it was back then. And the cost of low-level literacy to the health industry was staggering. Namely, the individuals that are last into the hospital are those with the lowest literacy, and those that stay the longest are low-level literacy. So this is old research, but it's again coming back to the point that there's a connection there that I think is very real. And I guess I feel a little bit like Linda said. I was kind of struck by what was said here or being emphasized, or it wasn't being emphasized. I think I understand it better by what was said subsequently and putting the information in its context, but it's an important thing. I'd like some further information from the panel maybe on this one point.
Before letting Shannon address the question, I just want to make one important point that a lot of the previous studies on this topic have not controlled for background characteristics. So our slide showed very clearly that literacy, numeracy, and PSTRE had strong associations with health before introducing background characteristics. But what we found is that once you control for age, their insurance status, their educational attainment, their parents' education, their marital status, number of children in the household, English language, nativity, etc., the influence of literacy is fairly small. So it's in the unadjusted models without the control variables, it's all those other things that are making literacy seem to be much more important. So it's still important, but there are a lot of other things going on that you have to control for to see what the unique contribution of literacy is to health status.
Yes, if you think about the unadjusted models, right, I think the odds ratio is something like, I don't know, 1.13, which means that a 10-point increase in the literacy score was associated with about a 13% increase in the odds of being in a better health category. That's a pretty large effect size. But when we think about what leads people to be more or less literate, there are characteristics of our lives that begin at very early stages that impact our literacy, right? And so one of the things that we controlled for was parental educational attainment. So we know that people who have parents with higher levels of education are more likely to be more literate themselves. So once you control for those sorts of characteristics, what's left over for literacy itself is very, very low. If you think about it in terms of among like groups of people, among people of the same level of education, among people of the same race, ethnicity, among people of the same age group, what impact does literacy have on their health? Then that impact is really low. So in terms of policy implications, one thing we might think about is we know literacy is important and we know the groups of people who are likely to be less literate. Therefore, we focus our attention on those groups of people, low educational attainment, parents with low educational attainment, people with low English learning skills, people with disability statuses. Those are the groups for which improving their literacy is likely to have the best impact on their health.
Vivika Halabu, Estonian Ministry of Education and Research. I do have one minor comment about, I think it was Esther's presentation. First of all, thanks for the interesting presentation, but I have a slight hesitation about the variable post-initial education and the type of this. If I remember correctly, then in PIAAC people were first asked, did they participate in any trainings? Then it was asked, if yes, then in how many different ones? And all the following questions, which were more detailed, they were only about the most recent one. And I think it adds some noise about this variable. And I just think that maybe it should be like marked somewhere or taken into account that people might have attended different type of courses as well during within 12 past months before the survey. But if I remember it correctly, then you can correct me.
I'm a little confused in the question. Do you mean they might have participated in both online education and on-the-job training?
Yeah, exactly.
So one of the things that we did before we separated out the different types of post-initial learning was just create a combined variable to see if participating in more of these sorts of things, a count variable essentially, was associated with better health. And so that one showed no different patterns. It wasn't any more interesting, in other words, than looking at them separately. And our research question was, which type of post-initial learning would be most strongly associated with health? And so it was really important for us to pick out which types of activities, specific types of activities, were most strongly associated. But that's not to say that people who participated in one type of thing weren't included in another type of analysis, that they also participated in that. And so people could have participated in both on-the-job training and distance education, and they would both be accounted for in those separate models.
Just a word of caution about throwing away the small literacy effect. We did some cost-benefit analysis in Canada where we linked literacy gains to the propensity to use a hospital visit or visit a doctor, and because those things are such high value utilization in the system, you get to really big numbers even with that small effect. And so if anybody's thinking about reducing healthcare costs, boy, you should pay attention.
Yeah, so that would be interesting to look at with the future research looking at healthcare utilization. And I want to reiterate that we're not negating the importance of literacy. I mean, our studies showed that literacy does matter. There are also other things that matter just as much or more. So it's a both and, not an either or.
I just wanted to pile on here to make sure we don't try to translate effect sizes from these cross-sectional analyses into what might be observed longitudinally and experimentally, in interventions such as the one that Scott described. And I think when one looks across a wide number of studies, it's fairly clear that it's certainly worth conducting those studies to answer the question. We can't obviously get the causality and shouldn't interpret effect sizes as likelihoods of having valuable impacts from interventions to raise literacy scores.